Delegates, please wait. Our guest is having some network issue. She will be joining soon. Delegates, please do wait. Our guest will be joining soon. Good evening, ma'am. Dr. Sipika, ma'am. Are you there, ma'am? Good evening,
Doctor,
ma'am.
am I audible? Good evening.
Ma'am, welcome to Sudhir Raj Memorial Series, ma'am.
Yes, yes, thank you.
Ma'am, I'm a student of Ayurveda College, Coimbatore. Today's session will be handled by me, ma'am. Ma'am, you will be sharing the screen, ma'am?
Yes, yes,
We
I will
prepared
try
any
to
PPT,
share.
ma'am? Or
Okay.
we should help you share the screen?
No, I will share the screen. Just let me know. Should I
Okay.
share right now?
No, ma'am. We prepared some intro for you, ma'am.
Okay, fine.
Ma'am, shall we begin the session?
Yes, yes, yes.
Okay, ma'am. Thank you, ma'am. Every sunset brings the promise of a new dawn. Get your thoughts calm down, get all blossom. Good evening, everyone. With great joy and immense exaltation, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. Sudhir Raj and Memorial Webinar Series organized by DIKSHA E-Learning in association with Ayurveda College, Coimbatore. In today's session, we will be discussing about Asrigdara with special reference to DOB and its Ayurvedic management by Dr. Sipika Swati MS. Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbances-free session. In case of any disruption, please check your internet connection first, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be posted in the chat box. Question raised will be cleared at the end of the session. Next, I would like to invite Dr. Vandana, Assistant Professor, Department of Prasudi Tantra, Ayurveda College, Coimbatore, to deliver the welcome address. Over to you, ma'am.
Thank you, Donna. Am I audible?
Yes, ma'am. You're audible, ma'am.
Good evening, everyone. It's my pleasure to welcome everyone for today's webinar session. We'd like to extend a special welcome to our guest of honor, Dr. Sipika Swati Madam, who will be speaking later today. We're all excited to have you all here for today's session on Dr. Sudhir Raj N Memorial Webinar Series, organized by Ayurveda College, Coimbatore, powered by DIKSHA E-Learning under the banner of Azadi Ki Amrit Mahotsav. I'd like to thank our principal, Dr. Chandramaulishwaran sir, and Vice Principal, Dr. Tulya Mohandas Madam, for their support and stewardship. We are all waiting for today's session on Asrigdara with special reference to dysfunctional uterine bleeding and its Ayurvedic management by Dr. Sipika Swati MS, who is currently working as the Associate Professor, Department of Prasudi Tantra and Sri Roga at IPGT and RA Jamnagar, Gujarat. Let's welcome her. I hope that today's session inspires ideas and discussions around the ways that we can understand Asrigdara with DUB. I'd like to conclude by thanking all the invitees for being here for today's webinar session. Thank you all.
Thank you, ma'am. It's a great pleasure for me to introduce our guest speaker, Dr. Sipika Swati, Associate Professor, Department of Prasudi Tantra and Sri Roga, IPGT and RA Jamnagar, Gujarat. Dr. Sipika Swati has completed her UG and PG degree from IMS BHU Varanasi. She passed her MD out in 2015. She has won 6 gold medals in her academic career. She is currently working as Assistant Professor in ITRA Jamnagar in Department of PTSR. She has a teaching experience of 6 years and 9 years of clinical experience. She published 30 articles in national and international journals. She has also presented 20 papers in various seminars. We are very proud to have you here on this session today, ma'am. Now, without any further ado, let me hand over the session to respected Dr. Sipika Swati ma'am to enlighten our minds with her knowledge. Over to you, ma'am.
Thank you, Doctor, for introduction. Now I would share my screen. Just let me know.
Please share, ma'am. If you share, ma'am.
Yes, is it visible, Doctor?
Yes, ma'am. It is visible, ma'am.
I will do slideshow, okay?
Okay, ma'am. Okay, ma'am. Sure.
Is it fine?
Yes, ma'am. It is fine, ma'am.
It's okay, Doctor?
Yes, ma'am. It is okay, ma'am. You can start the session, ma'am.
Okay, thank you. Good evening, all. Respected organizers and the authorities who have just organized this memorial session. I am thankful to them for giving me the opportunity to give my views on this Asrigdara and with special reference to DUB and its Ayurvedic management. And I am also thankful to the team members, Dr. Akhil, who have contacted me for this lecture. Thank you. And just we will begin the session. So my today's topic is Asrigdara, with a special reference to dysfunctional uterine bleeding and its Ayurvedic management. First of all, let me just discuss what we are going to discuss in this 1.5 hours. First, we will have to learn about the concept of Asrigdara and DUB in Ayurvedic as well as my modern parallels. And along with that, we will be discussing Ayurvedic management and what are the area of integration where we can have integrated approach to treat our patient. And some good researches, what we have done here in ITRA Jamnagar and also in all over India in renowned institute on the topic of Asrigdara. So starting with the Ayurvedic concept, we all know that Asrigdara, I will just not go in the conceptual point very much, but we will just brief these things. It has been derived from two words. We all know that Ashrig and Dara. And Ashrig, we all know it means that blood, and Dara, it means dhiran, it means secretion. Ashrig ashyate chipyate hidrein chakravat parivittaye nikhil dehe iti Ashrigdara. That means excessive flow of blood. The word itself denotes, we call it as Asrigdara. And when it comes for the definition, we all know that in Madhav Nidan it has been quoted that Raja Pradiriyate Asmat Pradha Tain Sa Smrita Asrigdiriyate Chavyate Yasmin Nityam Asrigdara. And in Charanga Shamita also Tadevati Prasangin Pravritam Anritavapi. This is a different point classes of view according to different acharyas. Acharya Charaka only just discuss about the amount Pradiryate iti vistarito bhavati, and he called it as Asrigdara. But in Shushruth he told that the bleeding which occurs excessive in amount, either excessive in duration, and also he quoted that intermenstrual bleeding. These three he just kept under the umbrella of Asrigdara. Like we call it when we will compare further, we can include menorrhagia as well as metrorrhagia, both in this umbrella of Asrigdara. Doctor, is my slide moving or is it still the same? Hello?
Yes, ma'am.
My slide is moving or not? Yeah, it's fine.
Yes, ma'am. It is moving.
Yes, thank you. And
You can continue.
where the Acharyas has quoted the clinical features of excessive menstrual blood, then bleeding. The Acharya Shushruth has told that 2 and 3 more important clinical features, what we are still seeing in our OPDs, like when there is excessive flow of menstrual blood, ati pravritti, it means excessive bleeding, foul smell, along with angamard, means whole body ache. We all know that excessive bleeding leads to pandu or anemia, and it further leads to whole body ache and sometimes delirium and sometimes weakness, lethargy. All these symptoms come along with this, the excessive menstrual flow. And Acharya Harith has also quoted that Vandhyanam chirnaryastu vatim paripurta chiram cha na bhavet tasmad artom cha adhikaya. Hey, I would like to say one thing. We all know that when any infertility patient comes to our OPD and when we take her history, anyhow, in any means, we get some menstrual abnormality. Almost in 70-75% lady, they complain about something, some problem in their menstrual cycle. So we should take cautiously the menstrual history. It itself just denote what are the doshas which has been aggravated or which has been vitiated in that lady. We should just focus on the color, the amount, and the duration of bleeding of menstrual cycle. And when we take the infertility patients' menstrual history, we just found some about the abnormalities in menstruation. And we all know that when milk secretion depends upon the prolactin hormone, which is secreted by the pituitary gland. And the prolactin inhibitory hormone, which controls this secretion of prolactin, which is secreted by hypothalamus. And we all know in that infertility patient, the whole HPO axis is disturbed. The causative factor may be anything else, like due to stress or due to some infection or inflammation. But the HPO axis is being disturbed. So Acharya Harith, we should see how much our Acharyas has been aware at that time also. He has directly correlated. Like if any infertile patient will come to you, her Chirva Nadi is cannot be, because she is Vandya, so she cannot be pregnant, and there will be not induction of prolactin hormone. So her Chirvaha Nadi is Vatin Paripurita. So we all know that Chir, Stanne and Artho are the Upadhatus of Rasa. So when the Chirvaha Nadi is Vatin Paripurita, there will be itself excessive secretion of menstrual blood. So we can correlate these things with that our HPO axis phenomenon also. Then comes the synonym. We all know that Asrigdara, we call it sometimes Pradara, Rakta Pradara, or Asrigdara itself. And where the Ayurvedic concept related to Asrigdara? Vata Pitta predominant Avarana Janya, we call it Agni Dusti Janya Pitta Vikriti. Many acharyas has taken it under the umbrella of Rakta Pradosha Vyadhi. Some has told Prameya Pradara, Ati Nidra Cha, Rakta Pradosha Cha, like these things. And Acharya Shushruta has also kept it under the complication of all the Yoni Vyapaks, Asrigdara. And according to Ashraya Bhava, we also just correlate the Asrigdara. And when it comes to psychological view, Rasvahini Dushyanti Chintana Ati Chintana, we all know in Rasva Shrutas Dusti, it has been mentioned that Ati Chintanat, it leads to Rakta Dusti, Rasa and Rakta Dusti, and hence it leads to Asrigdara. Now comes the Ayurvedic diagnosis. We all know that Acharya Shushruta has kept Rakta. 3 doshas has been described, but Acharya Shushruta has described 4 dosha, we all know. He has also kept Rakta in the 4th dosha. And Asrigdara is Rakta Pradosha Jiryadi. Pachyante Rakta Doshaja Kust Visarp Pidika Rakta Pitta Asrigdara. Acharya Charaka has quoted it. Like I have already told, quoted in one of the Upadra of Yoni Vyapad. And Acharya Kashyap has in Dusprajata complication mentioned Asrigdara there, that it is one of the complication of Dusprajata. And I just want to focus when we will come on the etiological point of view, when we will see the Nidanas of Asrigdara, we will just shocked all the Nidanas are Pitta vitiating Nidanas. And when we just focus on the Samprapti, the Acharya has quoted that Vayu also get aggravated along with Pitta. So why does, when all the Nidanas are of Pitta aggravation, then why Vayu is aggravated? So here the Acharya Charak has told that Vayu get aggravated because the vitiated Pitta and Rakta blocks the marga of a Vayu. So Vayu get vitiated, and along with Rakta and Pitta, it just fills the uterine vessels, and thus it increase the amount of menstrual blood, and the flow will increase, and then it leads to menorrhagia or Asrigdara. So we call it Pitta Avrit Apana Vayu. And we all know that what are the roles of Apan Vayu? I will not go in the detail that it leads the excretion of semen, urine, and fecal matter, as well as Garbha, Niskraman, all is under the action of Apana Vayu. When there is vitiation of Apana Vayu, there it leads the vitiation of excretion of all these things. So ultimately it causes a Asrigdara. This is the Arthodusti action in short. We all know these things. We all know that when there will be problem in menstrual bleeding, and Acharya Shushruta has quoted that praja utpadane na samartha bhavanti. Whenever there will be problem in menstrual blood or menstrual bleeding, either in flow, amount, or duration, that lady cannot be pregnant easily. Now we will come on the hetu. Under the three types of hetu, Acharyas has classified Haraj, Viharaj, and Vyadij. I have already told that in Hara, Lavana, Katu, Snigdha, Amla, Guru, Ati Snigdha, and in Vihara, Ati, Mathun, Shok, Diva, Shok, we will show like this. We can just justify in this sloka. Ya Atyartham Shivate Nari, Lavana, Amla, Guruni, Cha, Katuni, Athvidahini, Snigdhani, Pisritani, Cha. Grami order further. I have told that when we will see this, all the nidanas, all are pitta aggravating and pitta and rakta as well as rakta aggravating. And the vata get vitiated due to marga avaran by pitta. So this vata take pitta and rakta and fills the uterine vessels and just leads the excessive secretion of blood. What we call it is Asrigdara. Here is the samprapti, what I have already discussed. And there are three: diet, lifestyle, and psychological factors are three main nidanas. Like Ati Lavana, Amla, Guru, Katu, Vidahi, Snigdha, we should be very cautious while taking history of Asrigdara patient. Because we all know that first line of treatment of any disease in Ayurveda, Acharyas has told Nidana Parivarjan. So we should take the history properly and what is its dinacharya. It is very important. And we should try to exclude, just focus on this nidanas, whatever Acharyas has told. Nowadays, when we were in reading in MD and we were in DMS, we just read the nidanas and think all the nidanas are same. Ati Lavana, Amala, Guru, this, and we just skip that thing. But it's not that all the nidanas are same. Why if it will be same Acharya Stalak, why he have taken the pain all time writing the nidanas in the 3 lines that shloka. But when we will just emphasis on one to one nidana, when we will look, this is very specific to different disease. Some specific nidanas are there, which leads to that samprapti, pathogenesis of the disease. So we should just learn and just think on each and every nidana of every disease, whatever Acharyas has told. Then we will be able to treat the disease properly. Because if we will giving only medicine and we are not doing nidana parivarjan, then there will be relapse of the disease. Sometimes we think that I am just prescribing the disease, medicine to the patient. 4 or 5 days, the patient will be relaxed and symptoms will be less. Again, after few visits, he will just complain about the same thing. Like doctor, I am bleeding profusely again. Why? Because nidanas we have not stopped, but she used to consume. So we should take care of each and every nidana, whatever Acharyas has told. And first, what we have to do, we have to stop all the nidanas. Then we have to just prescribe the medicine. This is the samprapti, whatever I have told already. And in samprapti Ghatak, we all know that a dosha is vata pitta, and our line of treatment is also based on this 2 doshas, vata and pitta pacification, and dushya, rasa, rakta, and artha. And in Agni, Mandagni is there, and we all know that Mandagni, Ashtanga Hridaya has told Mandagni is nidan of all the diseases, whatever we know. Roga, Sarve, Api, Pupianti. Rasava, Shrotas, Raktava, Shrotas, and Artava, Shrotas is involved. Shrotodustri is Ati Pravritti, and Udbhavasthan is Pakvashayutta. That's why Vasti is told to be a good treatment of Ashrigdara. Adhishthan is Garvashay. When it comes to clinical feature, I have already just mentioned in the previous slok that Ati Prasangen, Ati Prachuryen, Dirvkalanubandhe, like excessive bleeding or prolonged bleeding. Pravrittam Anrita Vapi, intermenstrual bleeding, and Anyadra Lakshana, different from the normal menstrual feature. It has also been quoted under the umbrella of Asrigdara. Now it comes to modern aspect. I have just mentioned that we can correlate it with dysfunctional uterine bleeding. Nowadays, we call it as active uterine or abnormal uterine bleeding, and it is considered as one of the most common and perplexing like menstrual disorder. It also affects the physical, psychological, and mental health of the patients. And it also just one of the most common cause of hysterectomy also, we all know that in these days. And prevalence, when it comes to the prevalence, 30 to 50% of prevalence in reproductive age group. And 60% every year goes to hysterectomy. And when it comes to just DUB, we all know that it can be seen in two extreme phases of reproductive life, like one in adolescence and just when after the menarche, and one in the just perimenopausal phase when the women is of 40 to 50 years old. And we can, in AUB, we can include menorrhagia, metrorrhagia, polymenorrhea, and just dysfunctional uterine bleeding. Menorrhagia, we all know that bleeding, the main thing is in menorrhagia, bleeding will be cyclic bleeding there. But the amount and duration will be in excessive. We know all in that in normal menstruation, the women bleed 80 ml per day. But in menorrhagia, the amount will be more than 80 ml and duration will be more than 7 days. And metrorrhagia, the main feature, there will be acyclic bleeding. If we will take history, patient cannot tell her LMP when it starts, when it stops. And in menorrhagia, we just mixed picture is there. Polymenorrhea, we all know that their cycle is reduced to 21 days. These all menstrual abnormality we will just see in active abnormal uterine bleeding. But when it comes to DUB, we all know that there is abnormal uterine bleeding without any detectable pathological cause, organic, systemic, or iatrogenic cause. That's why we call it as one of the functional problem of HPO axis, and it is totally endocrine in origin. Because we cannot, there will be no any anatomical issue, fibroid, these all things are excluded from the DUB. And there will be two type of DUB. We know that ovulatory and anovulatory. We will see later on. Now, in 2011, the Federation of International Gynecological Anatomy, the new books which we are seeing in the DC Datta, the main very good thing they have incorporated, palm coin method for just according to the causes of what are the causes of abnormal uterine bleeding. And it is very easy to, when we will just learn this abbreviation, it is very easy to just recognize the diagnostic causes, like P for polyp. We all know that cervical and endometrial polyp leads to endometrial bleeding, intermenstrual bleeding, and sometimes menorrhagia also. Adenomyosis, very prevalent these days, and it is also one of the most common cause of infertility also, especially secondary infertility cases. We have treated a lot of patients of adenomyosis having secondary infertility just with the Ayurvedic management very successfully, and they got pregnant second times also. Leiomyoma, malignancy, and when it comes to point, it just coagulopathy, ovulatory, endometrial, iatrogenic, and not classified. This is very good to our MD scholar or PG scholar can just mug up the diagnostic causes. When it comes to type of DUB, as I have already told, ovulatory and anovulatory. In some patients will come to you with normal ovulation pattern. There will be ovulation, but what are the things which are causing problem? cycle will be shortened, and proliferative phase will be short, endometrial will be normal, then it comes under polymenorrhea, menorrhagia. I will just skip these things. We all know that we can diagnose easily polymenorrhea, menorrhagia, oligomenorrhea when the menses comes after 35 days. What I want to emphasize that in ovular bleeding, there are two types of bleeding: irregular shedding and irregular ripening. It is very common. Some patients will come to us and they will give us history when we'll take menstrual history. They will just tell us that, doctor, I have just spotting in previous 2-3 days, and after that I have normal flow. Very common scenario. This and especially young girls, this is what we call is irregular ripening. And some patients come, especially in aged patient, they will say that I have whole month I have a spot, 15 days, 20 days, then it will just stop automatically. Then in again cycle I have a spot bleeding, no free flow of blood. It comes under the umbrella of irregular shedding, and it is found in extreme of reproductive age, like near perimenopausal age. What is the difference, hormonal and difference between these two? Because this is very confusing when we just learning the things. In irregular ripening, first we will take irregular shedding. In irregular shedding, the name itself suggests there is desquamation of irregular desquamation of endometrial lining. Endometrial used to just desquamate for 15 to 20 days, and thus the spotting will come. Why it occurs? It occurs because there is just lack of estrogen hormone. There is prolonged sustained release of luteinizing hormone. So progesterone will not withdraw. We all know that for normal menstruation, just 4 to 5 days of menstruation, estrogen and progesterone, all the hormones are withdrawn from the blood. Then menstruation comes. Here, there is sustained effect of work of corpus luteum. Due to that, there is sustained release of LH luteinizing hormone, and this leads to inhibition of FSH. Also, there will be no ovulation, no recruitment of new follicle, so no estrogen secretion, and there will be no regeneration of endometrium. Also, these all scenario leads to irregular shedding of endometrium. And other thing is irregular ripening. Irregular ripening, in irregular shedding, progesterone sustained release. In irregular ripening, there is lack of progesterone secretion. Corpus luteum is not working properly. We call it as luteal phase defect also in infertile patient. So it is very important to diagnose this two thing. And we get in OPDs like 50-60% patient will give you this type of history, because the treatment protocol is very much different. We will discuss it later on. So you have to just be cautious of irregular shedding, what we call irregular shedding, and when we call irregular ripening. History, diagnosis, history, examination, we all know these things. Investigation, we go through normal CBC, hormones, prolactin, TSH, prothrombin time. It's very important to detect any type of coagulopathy. And just history of some endometrial biopsy or DNC, previous DNC, it is also important. By USG, we can just rule out the anatomical causes like fibroid, polyp, etc. And factors which regulate normal amount of bleeding during menstruation. We all know that prostaglandin F2 alpha has a major role in the homeostasis of menstrual blood. Another is fibrinolytic system, because there will be formation of platelet clot on the blood vessels, which leads to hemostasis in normal menstruation. And when these two altered, we know in anovulatory bleeding, like in case of metrorrhagica hemopathica, there is anovulatory bleeding. There is no ovulation. When there will be no ovulation, there will be no progesterone secretion. And prostaglandin F2 alpha is formed by arachidonic acid under the action of progesterone. So when there will be anovulated bleeding, there will be no formation of prostaglandin F2 alpha. The cycle will be painless and profuse bleeding will be there. There are 4 types: Vata, Pitta, Kapha, and Sannipata. We all know these things. I will just skip. Complications: Dorbalya, Brahma, Mursha, Tam, Da. These all are complications what we just got in anemic patients also. Here comes the prognosis. Management. What will be the management of Asrigdara? How we are going to manage this Asrigdara? Either through integrated approach, either through Ayurvedic approach. And what is called management, we all know that we have to treat the patient in this way, that we should pacify the vitiated dosa, and at the same time we should not aggravate the normal doshas. So this will be called a good management. And this is also a general management skill also. We should take care of these things. And 2 types of management we all know, that is Snehadi Kriya Shadhe or Sastra Shadhe. In AUV also, in modern also, that sometimes they will prescribe OCT. But when it is not controlled by that, we have to go through endometrial ablation and at the end hysterectomy. What are the Ayurvedic skill management? We all know for the check of the bleeding, Sandhan, Skandan, Dahan, Pachan, these 4 procedures our acharyas has mentioned. We can also do Nashye, Virechan, Vasti. Kashyap has told Asrigdara to be Virechan Sadhe. Charak has told it to be Vasti Sadhe. Here we are also doing Uttar Vasti, Pichu, Agnikarm, Charkam, all in this Asrigdara. We will see in detail each and every aspect. Chikitsa Siddhant. We know that Acharya Charak has told to treat Asrigdara as Raktatisar, Raktapit, or Raktarsh line of management to do in the Asrigdara. These are the 4 types of management we can do, like conservative, surgical, and in parasurgical we can do Agni Karma, Shara Karma, and Panch Karma, like Virechan, Vasti, so what we are doing here. Now comes the management. What are the different yogas which have been mentioned in Asrigdara? We all know that very commonly we are using in our OPD Pushyanuk Churna and with Tandulodak Anupan. And here we push with Pushyanuk Churna, we add Suddha Spatik, sometimes we add Khadira, we add Lodra also. With and Vasa Adi Churn, we all know some theses have been carried out that Vasa Churn has uterine contraction property. So Vasa Churn we do. Sometimes we give a Pushyanuk Churn with Vasa Swaras also. Chandanadi Churn, Utpaladi Churn, Satavri Grit. Satavri Grit Nasi is very good in preventing the relapse of active uterine bleeding. Pushmand Khanda, Bol Parpati, Pradrantak Ras, Pradarari Ras, Sheila Jeetavati. We all know that for Sheila Jeetavati, I just want to just tell you, in adenomyosis patients, we all know that there is huge profuse uterine bleeding, and we know that there is aggravation of pitta. So Sheila Jeet is very good where you want to do Chedan and Lekhan. And apittakar chedan and lekhan. It will not aggravate the pitta, and at the same time you can use it as it's a chedan and lekhan property. So it has very good result in adenomyosis patients. We know that in adenomyosis there is thickening of myometrium, and endometrium is just incorporated within myometrium. So one of the patient we have treated here, he has posterior wall is 8 to 9 centimeter thick, adenomyosis patient, and also of secondary infertility. We have found very good result with this Sheila Jeetavati. It helps in ovulation also, and her adenomyosis was also decreased in 1 or 2 months treatment. After that, Pradharadilo, Jirakka Deavale, we all know that it's very good. Ashoka rest, we cannot forget the Ashok Char Chirpak. It has been mentioned by the Acharyas, especially in Pittaj Pragati patient. It has very good result. Ashok Chirpak. Dhatiki Push, Gokshuradi Guglu, Chandraprabhavati, and Shatavari Kalp. We can use Shatavari Kalp, and it has also very good result. Where just, especially in Minarch patient, in adolescent patients, Shatavari gives very good result, because sometimes some patients come, they are very lean and thin, and also they are not taking the diet properly, and they are taking junk foods, and their mother can, because that time HPO axis has been not set properly. So many of the patients after Mina come to you with the complaint of excessive uterine bleeding. So we just want to give them a good uterine tonic in the form of Shatavari, in the form of Ashoka, in the form of Lodra, or combination we can use. So that it will act on HPO axis, correct the HPO axis, and there will be normal setup of HPO axis function, and uterine bleeding, that abnormal bleeding itself will decrease in the course. These are, I've just kept some modern point of view, what they are doing, that control bleeding, prevent recurrence, and preserve fertility also. These are some goals of management of Asrigdara. Correct associated conditions like anemia and lethargy, all these are conditions we have to look through. When if the patient is very much anemic, we have to just correct her HB count also. Induce ovulation in patient who wants to conceive. Effective methods, NSAIDs, danazole, GnRH agonists they are using. We'll just skip these things. In acute bleeding, we all know that they are using OCP, sometimes progesterone only therapies, and styptic, some styptics also, ethamsilate and tranexamic acid is going to be used. Surgical management, DNC, endometrial ablations. Here I just want to focus on this pelvic congestion syndrome also. We know that this is due to, it is a medical condition in women caused by varicose vein in lower abdomen. Due to congestion, any cause which leads to congestion in pelvic region, it will ultimately lead to Asrigdara. It's going to lead in. So we should just keep in mind when we are just dealing with this type of patient, this pelvic congestion syndrome also. Patient will complain of dull aching pain in the pelvis, low backache. And especially they will just tell you that dysmenorrhea, congestive type of dysmenorrhea. So in congestive dysmenorrhea along with pelvic congestion syndrome, they will complain of excessive bleeding. We can diagnose it by USG, the underlying pathology. Now I will just focus on some very good researches. Here we can, there are many researches where oral drugs have been mentioned, and we use many of these drugs in our OPDs also. Like one of the researches has been done in 2017, role of Darvyadi Ghanvati. You all know that Darvyadi Quath has been mentioned in the treatment of Asrigdara by the Acharya. But to improve the palatability and compliance of the patient, we have given in the Ghanvati form. And its ingredient was Darvi, Rasanjan, Kiratik, Vasa, Mustarak, Chandan, Ark, Pushpa, Bilva. And it was given 2 tablets 3 times a day for 2 months. Okay, and group B, Raktastambhak Yog, it's Majufal, Garrix, Phatik, Khadir. We are frequently using Raktastambhak Yog here in our OPDs, along with Shuddhas Phatik to control, check the bleeding as a styptic here. It was given as standard control for 2 months, and a very good result was shown with Darvyadi Ghanvati. So we can give Darvyadi Quath as Ghanvati form, because many times young girls, they don't want to take Quath decoctions due to palatability issue. So it's better to just prefer Ghanvati form. one study has been done, randomized control trial to evaluate effects amal ki, sanjan harit ki chud. This was also a very good study while I was searching there. And that it's amal ki rasayan harit ki chud in group B, 30 patients were given, and ashok twak chud with tandulodak anupan, and 3 consecutive menstrual cycle was followed. And that group A showed very good result, and it also shows increase in hemoglobin percentage also. So we can use this thing also. Putajasta coagulate, it is a very good drug. And in some patients, like when the patients are very lean thin, but Agni is good. You should just consider Agni also, because when you are prescribing of late in Mandagni patient, if patient has Mandagni, you cannot prescribe Avalehi form there. So first you have to improve her. If you want to prescribe Avalehi, you should also give some Deepani Apachni drug along with that. And it that Kutaja Astakavale, it contains Lajalu, Pata, Dhatki, Musta, all have styptic property, and they all are Pitta Shamak, Ativisha, Mochus, and Ativisha also have Deepan Bhashanam property. Along with group B, Kushmand Kandavale was given. And group A showed very good result in prolonged blood loss, and group B also at the same time. But with Kutaja Astakavale, it was good result. Effect of Shunthi Lodrachud. You will be shocked. Sometimes we just we are not prescribing. Many people not prescribing Shunthi in Asrigdara, so that it will increase the bleeding. But it is not like that. I have seen many articles, even in Chinese and in Korean articles also, traditional medicines, that they have published many articles on Sunti Fan and Sunti or Sunti Siddhajal in the management of Ashrikdar. It works very well, because it acts as Deepan Pachan, and also it gives us Grahi property. So by all this action, it shows very good result in Ashrikdara. Evaluation of Charakokta Madhukadi Yoga in Pitta Ashrikdara. It is also a good Madhukadi Yoga, very good drug. Shatavari Chun, what I have told that Shatavari Chun along with Shatavari Tel Uttar Vasti. Here we are also doing Matra Vasti in Ashrikdara patient. First, if the patient is of chronic patient, we first in the intermenstrual period when bleeding stops, we used to plan put on the patient on the viration according to the cost and prakriti of the patient. And after viration, we are if patient will and she wants to stay in IP, we just give Matra Vasti also of Chandan Mala Lakshadi Tel, and it gives very good result. You can give 60 ml of Matra Vasti and you can plan for 8 or 10 days. Again, this is a very good Rashoshad. We can use Bol Badras and Bol Adi Chun in the management of Ashrikdar, and we all know that Bol Parpati and Pradharipurash shows good result in Ashrikdara. Bhumi Amal ki Chun. And it has also been mentioned in the treatment of Rakta Pitta also. So it shows good result in Pitta Rakta Pradhar. And this is also done. Amal ki Chun. With Shalmali grit, many grits have been mentioned, and in Pitta Prakriti patient also the grit is very good. We all know that for pacification of Pitta, Acharyas has mentioned grit to be very good and just basic line of treatment. So whatever drug we want to give, we can just prefer grit form, especially when the patient is also of Pitta Prakriti. Like we just Shatavari Tel, Matravasti we cannot be used, we can just prescribe her Shatavari grit. Bol Badarashi Nashrik, that it was also a very good study. It's very good drug. styptic management. What I was telling that first we plan Virechana, and then we also give Basti with Sadang Pani. And we all know that Sadang Pani is mentioned in Jwara Chikitsa, and it has Pitta Shamak property. So it's very good. You can simply prescribe Sadang Pani, just intake of patient during that days, and along with that, we just we should also in Nidana Parivajan we should also ask the patient to follow the Rajaswala Paricharya. This is very important because in these days no one is following the rituals of menstrual time. So it also leads and aggravates many type of doshas and which leads to Asrigdara. So we should just promote our patient to follow the Rajaswala Paricharya during that days. Chandanadi Churna, Darvyadi Ghanvati. Again, many theses have been done on Darvyadi Ghanvati. Role of Virechana. Here, I would like to quote one of the theses of our MD scholar has been done on Virechana along with Vasadi Churna. I will just I have mentioned it. This one, Dr. Pooja Chauhan. It gives Vasadi Churna. We have just prepared just for the compliance of the patient. We have just converted that churn in Ghanvati form. And we have just got very good result in that Virechana and Vasadi Ghanvati group. So many patients think that there is profuse bleeding, how we can do Virechana, why we should do Virechana. But if you are looking for the patient dosh, prakriti, post, bal also, and her agni also, so you can successfully plan Virechana along with any type of drug, whatever you want, and also along with Basti you can plan. So it will give prolonged effect of only oral medicine will not do because we know that Shodhan Chikitsa is very important. And here there is aggravation, here is aggravation of Pitta. So Virechana is best to just cope up with this aggravated Pitta. So we should plan Virechana. Either you can plan Mridu Virechana also according to the prakriti of the patient. So we should plan some Shodhana therapy if possible, or we can, if it is not possible, if you don't want to go in classical Virechana, we can give patient in Nitya Virechana also, like with Avipatti Karashuna, like according to the patient is of Kapaj Prakriti, we can just prescribe Aaron Fest Haritki also, or Haritki Chun with good in empty stomach to Pittaj Prakriti patients. So in this case, study we have got very good results. This was a very good study. I have just quoted effect of Rajaswala Paricharya in Asrigdara. It was a case study, and what I was telling that we should promote our just young girls and also the reproductive age females to just follow the Rajaswala Paricharya. Along with Rajaswala Paricharya, along with Nidan Parivarshan, our medicine, oral medicine will work very effectively. We cannot skip these things. We should keep in our mind that our acharyas has mentioned this Rajaswala Paricharya just to avoid any type of abnormality during the menstrual cycle. So we should promote our patients also to follow the Rajaswala Paricharya. And here, just for the conclusion, Asrigdara, we all know that Rakta Pradoshaj Vyadi. So whatever Chikitsa has been mentioned in Rakta Pitta, many drugs have been came from there, that Bhumya Amal Ki Churna, Utpala Churna we are using sometimes and it gives a very good result. Pravala Bhasma, Pravala Pisti, we just mix with Pushyanu Churna and it gives very good results. So we should just keep in mind the aggravated doshas. What we have to pacify the pitta and we have also pacify the path at the same times. And the most common cause what we are finding this time of Asrigdara, we know adenomyosis followed by pelvic congestion, DUB, PCOD, cystic hyperplasia. It can be prevented by through Ayurveda very much effectively with following Rajaswala Paricharya type style and timely intervention of drugs and Panchakarma therapy also. Area of integrated approach, what I have mentioned that in fibroid, we know that there is just surgical management of fibroid in modern. So there we have done a lot of thesis with chartel oil on fibroid along starting with Virechan, then Vasti, Lekhan Vasti, and then Charatel, Uttar Vasti, and gives very good result. In adenomyosis, I have told that we have successfully treated many cases of adenomyosis with secondary infertility with oral drug and Shodhana, like in Shodhana therapy, in Panchakarma. We just adenomyosis patient, we plan Panchakarma, Virechan, and after that we just put on that patient on the Vasti. Lekhan Vasti, because adenomyosis, we just want to do the scraping of that unwanted endometrial lining and the thickening of that endometrium. And after that, we put patient on with the prashamak medicine. And Shilajit Vati is very good because it helps in ovulation also. It helps in adenomyosis, that decreasing thickening of endometrium also. Ovarian cyst, chocolate cyst, we can all easily treat by our Ayurvedic medicines, these things. Take home message, I have just typed 2-3 lines. We know that there is ample of scope in Ayurvedic field for management of Asrigdara. We should be cautious, but one thing I would like to say, sometimes I have seen some scholars do one thing, like sometimes the patient come to us, and she have been bleeding since 2 or 3 months. Then that the same time, first we should just think, just give some styptic medicine in that cycle. Because if patient is complaining that I have lethargy, I have just vertigo, so just don't plan that Shodhana therapy in the same cycle. First, provide her styptic, because Acharya has told we have to just treat Asrigdara along with its symptoms also, associated symptoms. What are the complications? Daha, Dorballe, Murcha, Brahmit is mentioned. So first you just give styptic medicine, either in Pushyano, either Jashoshukta Sheerpak, either mixed Pushyano with Spatik and Praval Bhasma or Praval Pisti. It gives Pradranta Klo, it's very good. It just it has Pitta Shamak medicine, along with that it also correct the hemoglobin count also. You can you can add Lodrasha and Patrangasha combination. 15 ml or 20 ml BD or TDS. It is a very good styptic what we can give, and it also corrects Lodra. We know it corrects the SPO axis also, and just balance the doshas. So first in that cycle, treat the patient, give her a styptic, stop the bleeding. When the patient condition improve, then just plan all the therapies, either variation, vasti, according to the patient, according to the dosh and bull of the patient. It is very important. Just don't go in elaborate treatment in the same cycle. And if patients come to you, she is okay, so you can plan in that same cycle that with Shodhan therapy, you can start with the Shodhan therapy in the same cycle also. So it is right time to do hand-to-hand work in this for better public benefit and effective management of Asrigdara. And we all know that there is only a way of hysterectomy. Many patients come to us in 30-35 years age that some practitioner has suggested her for hysterectomy. So we can help that patient, we can lead that patient with our Ayurvedic approach, and we just give a good quality of life to that patient. So it's very important to just follow the siddhantas of our principles of Ayurveda and whatever the acharyas have told. And one thing I would like to quote, advise every patient, like dincharya, proper dincharya, Veg Vidharan, we know it's the base of many diseases. Agni Diptikar, Mandagni, it's also again a main culprit of many diseases. So we should just advise our patients a proper and healthy dincharya. We should don't just forget about the Agni. and Veg Vidharan, especially in females, we know every time due to social issues, due to just domestic work, they many times they hold the urges, and Veg Vidharan is one of the main causes of uh, many disease, especially in females. This issue is very. So we should just whatever I have told, we should just look on the nidanas where the main culprit is, and we should do nidana parivarjan, and we should just provide the patient some good healthy tips of Dincharya. Rajeshwala Paricharya, you should promote your patient to follow. You will definitely get very good result with Rajeshwala Paricharya. Thank you. Thank you all.
Thank you very much, ma'am, for taking your time to prepare for us such an extraordinary, wonderful presentation, which was incredibly informative. Now we will go ahead to question and answer session. Shall we begin, ma'am?
Yes, doctor.
Delegates, please post your questions in the chat box.
Delegates, you can post your queries in the chat box. Or raise hand to ask the questions directly to the speaker.
I would also appreciate if anyone wants to share their clinical experiences also. It will also good. If you don't have question, if you have some good clinical experience, you should share on this platform.
Ma'am?
Yes.
Am I audible, ma'am?
Yes, properly audible. Hello, doctor. Okay, I'm just looking for the chat box. Some question. Yes, doctor.
Yes, ma'am. Ma'am, please explain the Samprapti chart once again.
Okay, I will show you the Samprapti chart. Should I show the slide or I just demonstrate you without slide? You want to show the slide of Samprapti? Okay, I will show you.
Yes, ma'am.
It will be better. You will understand the Samprapti. Because Samprapti, it's very important to treat, because we have to do the Samprapti Vigatan to treat the disease. This one. Okay, what I have told that once we look for the Nidana of Asrigdara, we will find all the Nidana. Yes.
Sorry to interrupt, ma'am.
Yes.
Your screen is not visible to show the chart, ma'am. You should share your screen.
Okay. Yes. Is it visible, doctor?
Yes, ma'am. It's visible, ma'am.
What I was telling that when we are looking for the Nidanas of Asrigdara, whatever Acharyas has told, mainly all the Nidanas are Pitta and Rakta aggravating, because Pitta and Rakta has same gunas. So whatever Nidan will aggravate the Pitta, it will aggravate the Rakta also. So this aggravated Pitta in Nidanas chart, you will hardly get any Vat Prakopak Nidana. When you will take the history of patient, they will just give all the Pitta Prakopak Nidana history. So Acharya has told that Vata and Pitta both get aggravated at the same time. So that is what I was telling, that this aggravated Pitta. We know that Vata get aggravated by two ways, either by Dhatu Chhay, either by Margavaran. These aggravated Pitta along with Rakta, it averts the marg, natural path of Vata. So the Vata get aggravated, and this aggravated Vata take Rakta and Pitta along with it in the uterine vessels, because when it comes for Adhisthana, I was already told that Adhisthana is Pakvase, and especially in Pakvase, our Garbhashay. So in Garbhashay Gat Raktavahini, this Vata take Pitta and Rakta along with it and increase the amount of menstrual blood there. You know, Garbhashay Gata Rajo Vaha Shira Samashritte. Raktamadaye tad raja yasmad vivardhyati ashu. There is sudden increase of menstrual blood. We have just learned that Sadkriya Kal of Shushrut. Sthana Shanshray. Here the Sthana Shanshray, what is the Sthan? Sthan is Garbhashay, the Sthan of vitiated doshas. So there is sudden increase of menstrual blood in Garbhashay Gat Rajovahasira, and it leads to excessive bleeding in that cycle. This is what is the samprapti, disease progresses. So you can, when many times patients comes to you in the initial phase, like here we have studied Kriya Kal in Shushruta already has told with aggravating symptoms. Sometimes patients comes to you and or it comes to Chikitsa doctors also, and she just complain that Amlodgar, Pipasa, all the, like sometimes patients come initially to us with burning, maturation, all the pitta with the aggravating symptoms. If the Nidana goes, she used to consume the Nidana and no one is going to treat, no one is going to advise her Nidan Parivarjan. So again, it will lead to just further progress of disease. And it might be anything. It might be Rakta Pitta, it might be Rakta Arsha, it might be in any form. So and when the Sthan Shanshay will be in Garbhashay, it will be just revealed in the form of Asrigdara. This is the Samprapti. Okay.
Yes, ma'am. Thank you,
And
ma'am.
this is also the just steps of the treatment also. Initially, when patients comes to you with pitta aggravating symptoms, just when you can treat that patient easily, Vriddhi and Sanchay Prakopa Avastha. Okay, when you will treat that patient on that stage, it will not lead to Asrigdara. It will not lead to Rakta Pitta, either Nasagat Rakta Pitta, or either Urdhva Adhog Rakta Pitta, any type of Rakta Pitta. Okay.
Okay,
Is
ma'am.
it
Thank
clear?
you, ma'am. Yes, ma'am. It's clear, ma'am. Ma'am, moving on to the next question. Ma'am, please explain what is adenomyosis treatment.
Yes, I was telling that we have, adenomyosis. Okay, I think you all know what is the adenomyosis. It is just a form of endometriosis. When it resides within the uterus, we call it as adenomyosis. Here, what it occurs, the endometriums. We all know that there is clear-cut demarcation between endometrium and myometrium, and again in the endometrium there are two layers: functional layer, baseline layer. In every menstrual cycle we just shed out our functional layer, baseline layer is still there, and again in the next when after menstruation there is regeneration of endometrium from the baseline layer. Okay, and beneath the baseline layer starts the myometrium, and there is a junction between endometrium and myometrial junction, and clear cut demarcation. Even you can see in sonography also, USG also, when if you have just focus on that thing, there is clear cut white line, opaque white line demarcation. Okay, this demarcation is lost in case of adenomyosis. The endometrium start growing inside the myometrium, and the whole uterine thickening increases. Okay, we call it as adenomyosis. And again, the main symptom is huge profuse bleeding. And if you will take the history of patient according to Ayurveda, again you will get all the pitta aggravating symptoms. And it is a very common in pitta prakriti patient if they are not following Rajaswala Parichar and all these things. We have not put it that case report here. We have already published it to 3 journals. Start with, again I have told, start with the condition of the patient. If ballet is okay and patient don't have prolonged bleeding. If patient have prolonged bleeding, so start with styptic. Give Pushanung and all this thing, control the bleeding in that cycle, correct the Dorballe and that anemia, check the HB count. Again, after that, put that patient, if patient Bala and Agni allow, put that patient on Virechan. If not classical, then a Nitya Virechan. Like Avipattikar, if patient is of Pittash Prakriti, put that patient on Avipattikar. Okay, we all know it has Putki. Putki is Pitta Rechak. Okay, so it's very good. You can prescribe patient Avipattikar at the night time. Or also you can prescribe in Pitta Prakriti patient Haritki along with good empty stomach in the morning. Okay, daily. Okay, or if your patient is of like Kafash Prakriti, you can prescribe it and just Haritki. This type of medicine you can select according to the Hingu Trigunadi tail. You can also prescribe to that patient. You just put the patient either on Nitya Virechan or Mridu Virechan. After that Virechan, we just plan Matra Vasti. Okay, Matra Vasti with Chandan Bala Lakshadite. And oral treatment is very much effective. In oral treatment, Shilajit Vati, I have told that Shilajit is a Pittakar Chedan Vedan Lekhan property. So wherever you don't want to aggravate the pit, at the same time you want Chedan Lekhan property, just prescribe Shilajit. Look, Arugvardhini, Trikatu, Guruchi, it also has Lekhan property. In PCOD patients, in Kafash Prakriti patients, we prescribe these things like Arugvardhini along with Guruchi, Haridra, okay, for just Chedan Vedan Lekhan. But in Asrigdara, mainly Pittash Prakriti patients you will get. So you just prescribe Shilajitwati. And if your patient wants to conceive also, then it is boon for your patient. It just improve the ovulation. It is also having Rasayana property, we all know, and it also do the Chedana Lekhan. Just put out the patient also plain Shilajitwati, 1 BB. Okay, and along with that, we used to prescribe some Pitta Shamak medicine like Ashok, Godanthi Bhasma, Praval Bhasma, Praval Pisti. This combination we used to prescribe. In 2-3 months, you will get very good result. And if your patient wants to conceive, she will conceive also definitely.
Okay, thank you. Yes, ma'am. Thank you, ma'am.
Correct her Agni also and Nidan Parivajan. I have told, I am just emphasizing Nidan Parivajan is very important. Just correct her Dincharya, just correct her Rajaswala Paricharya. Then you will be succeed in your treatment protocol, whatever you are prescribing.
Yes,
And
ma'am.
one thing also, we in some patient, in one of our patients, we have planned Nasti also. She has undergone 6 months of OCP treatment by some private practitioner, and even the bleeding was not stopping. She has put 20 kg weight also due to OCPs, because we all know its side effect. And then anyhow, she was admitted in our IPD. That time it was important to check her bleeding, because she has many symptoms, lethargy, backache, and anemia, all these things. So we have put it on this styptic medicines, but we didn't succeed in that. So we just give her Durva Swaras Naste. With that Durva Swaras Naste, her bleeding was checked. So Durva Swaras Naste is also very good. Somebody will tell us that in Rajaswala, Naste is contraindicated, na? But it is contraindicated in normal Rajaswala Paricharya. And this is Vyadhi. So you can prescribe in bleeding phase also Nasse. And it has very good result, Durvaswaras Nasse. Okay.
Yes, ma'am. Thank you, ma'am. Ma'am, we have few people who have raised the hand.
Yes, yes.
Yes, ma'am. Dr. Amok, doctor, you can ask your doubt.
Yeah. Hello. Good evening,
Yes.
ma'am. Very nice
Good
session,
evening,
ma'am.
doctor.
It
Good
is
evening.
really very informative, ma'am. Thank you so much, ma'am. I'm Dr. Ritika, ma'am. एक्चुअली मैम मुझे ये पूछना था कि अगर पेशेंट में नित्य विरेचन करना है उसके पहले क्या उन्हें स्नेहपान कराना जरूरी होगा
No,
क्या?
no, doctor, no. In Nitya Virechana, Snepan is not needed.
Okay, ma'am.
Yes.
Directly we can go for
Yeah, directly along with your oral medicine, either you are planning for stiptic, either you are planning for Samprapti Vigator, you can just prescribe Nitya Virechana, whatever according to the prakriti of the patient.
ma'am, if patient is kapha prakriti, then what will be
I
the
told you, na, errand breast harit ki we usually prescribe here. You can just select whatever drug is available at your practice area and where you are living. Just select Tikshnoshn, Kaf Shamak and Tikshnoshn drug. Hingun, Trigunadi tel you can prescribe. You can Kapha Prakriti patient, you can prescribe Trifla also. Okay. But if the Pitta Prakriti, I have told you, Avipattikar is a good option because it contains Kutki. You can prescribe, like if you are prescribing just in Asrigdara patient, sometimes we prescribe because we all know coagulopathy is one of the criminal of in Asrigdara also. So sometimes we prescribe Faltrika Dikvat. Along with that, you can prescribe castor oil also in Kafach Prakriti patient. Empty stomach in the morning. It's very good. And errand is Vrishyavata Harana. Okay, you know that. So along with that Kwath, you can prescribe castor oil for Nitya Virechana also.
with Faltrikadikwat?
Yeah, Phalitrikadi, look, I just want to just tell you people, just we know one of the cause is coagulopathy in Asrigdara. Okay, modern people also sometimes give by any means with Phenixa and ethem salate if bleeding is not checking, they used to give vitamin K injections to check the bleeding. So why vitamin K injection? Because vitamin K is one of the clotting factor, one of the important cause to check the bleeding. So again, in our Ayurveda also, to treat that coagulopathy, we are just prescribing Faltrika Dikvat. And you will just shocked to know in some patient by that Faltrika Dikvat we get very good results in a Asrigdara. So if your patient is just previously complaining of some GI symptoms, na manda, agni, belching, and all these things, you can just assume that liver function is not proper, agni is not proper. So you can prescribe Faltrika Dikvat in that patient also.
थैंक यू सो मच मैम. मैम वन मोर क्वेश्चन मैम. एक पेशेंट है मैम, वो 22 डेज से उसकी समटाइम्स 22 डेज की साइकिल होती है, समटाइम 30 डेज की साइकिल होती है, बट ड्यूरेशन वो 3 to 4 डेज ड्यूरेशन रहता है. मैम क्या 20 डेज की साइकिल को हम एबनॉर्मल साइकिल में ले सकते हैं क्या?
Yes, doctor. What I have told na that metrorrhagia, acyclic bleeding. And in that polymenorrhea, especially we term it as polymenorrhea. When the cycle is short, here that luteal phase, that ovulatory phase, post-ovulatory phase is short. So we just put it in Asrigdara also. And in that patient, look, sometimes some patient when come with normal cycle is short, and bleeding is not very much profuse. So in this type of patient, you just have to prescribe some good uterine tonic, na, which acts on HPO axis. Here the Shoka rest and Lodra, this thing will act very properly. Shatavari Kalp, these things.
Okay,
It will correct her duration of cycle also. It will correct Ashrigdara also. It will improve in fertility also. Shatavari Kalp.
Okay. Thank you, ma'am. Thank you so much, ma'am. Once again, thank you.
Welcome, doctor.
Thank you, ma'am. Thank you, doctor. Next, we move upon Dr. Sandeep. Doctor, can you hear us?
Hello, thank you, ma'am.
Yes, doctor.
Ma'am, a 30-year-old patient has heavy bleeding, ma'am. So, what is the treatment in this condition? And bulky uterus is there, ma'am.
Bulky uterus is there and 30 years old.
Yes, ma'am.
Is chronic problem to that lady? Like
Maybe chronic.
from how many cycle? Have you gone through, have you done any USG? It might be due to fibroid also, doctor. It might be due to polyp also. First, it might be adenomyosis also. Like if it will be fibroid, our treatment, if you only want to check the bleeding, then the same protocol. If you want to treat that patient from her baseline, you just have to make one proper diagnosis. Just rule out some pathological anatomical cause. You have to rule out. If so, just do one basic baseline sonography. If there is no fibroid, okay, no cyst, because it is active reproductive age, na? It might be ovarian cyst also. Okay, it also causes due to pelvic congestion. What I was telling, it also causes heavy bleeding. Okay, so your treatment will depend on that thing. If there will be if there will be ovarian cyst, or if there will be fibroid, okay, then your medicine will be just changed after correcting her after first initially. If she had prolonged time of bleeding, first you have to give styptic medicine, then you have to treat the pathology underlying. If fibroid, you have to just prescribe a Chedan Lekhan medicine, this type of medicine. Along with that, you have to assess the Prakriti also. If ovarian cyst also, then Dashmul Kwath, Varun Shigru Kwath, Arogvardhini, Tripla Guruji, Nityanandras will come into role. So you just make a good diagnosis. Na? Now, what is the cause of that bleeding? That's why I was telling, na, we should just rule out the cause first. Then you will be able to treat properly. Either it will be just like to hit a arrow in that dark room. This will be like that. You will give styptic, bleeding will check again after someone 1 or 2 months. Patient will come again with the same problem. Because if there is fibroid in the uterus, okay, then how it cannot be treated only by styptic medicine. Na? You can check the bleeding for 1 or 2 months with that styptic medicine. But again, you have to put the patient on the true treatment protocol of that underlying pathology. So I will suggest just do one baseline scan. Okay. And if your patient is bleeding from a long time, just give her, according to the Prakriti, some good styptic medicine with the shamak medicines. Her bleeding will check. In the meanwhile, just do one baseline sonography, or just you should go also for PSPV examination. Sometimes you can rule out from PSPV examination, like cervical polyp might be the cause. These things you can rule out. Then plan your treatment. It will be good for patient also. Okay, doctor?
Okay.
Ma'am, another question is there, ma'am. How Nasya can be useful in the DUV, ma'am?
Yes. How Nasya? You know, Nasya, what we call Nasha Sirsodwara. And I have told you just DUB, dysfunctional uterine bleeding. Dysfunctional. Function is not proper. Of what? HPO axis. Okay, hypothalamus, pituitary, ovarian. Now it has been HPO-U axis, uterine axis also has been added in this term. Okay, so what this hypothalamus, pituitary, all the glands are reside in our this skull. And our acharyas has told Nasha is Sirsodwara. So if you are giving Nasty, the oil will be directly absorbed from the mucosa, nasal mucosa, and it will cross blood-brain barrier. You know, our blood-brain barrier only allow the lipid, oil, and ghrith. It is absorbed directly from the blood-brain barrier, and the medicines goes directly into that glands, particular gland, whatever they have to work. That's why nurse just play a miracle in this HPO axis. Infertility patient also, they are using nurse very commonly, where there is GnRH deficiency, and where there is FSH or low LH, and when there is an ovulatory cycle, this type. So it gives a very good miraculous result, nurse. this like this, it's acting, it corrects whole the HPO axis. By Nasi you can correct. Okay, doctor?
Yes, ma'am.
That's why now our acharyas were very brilliant. When you will see Unmad and Apasmad chapter, most of the drugs are in Ghrita form. You know why? Because the Ghrita, only that lipid can cross the blood-brain barrier, and it can act on Mastiska. Quath and Chun are rarely mentioned in Unmad Apasmad Chikitsa. Grits are mentioned. The same concept. That's why this oil and grit, whatever we are using in Nase form, this direct, it can cross the blood-brain barrier and it acts on the glands. You know, the pituitary is master gland, and in our female, hormones are very important. So we use this Nase.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am. Thank you, doctor. Next, we have Dr. Ganesh. Doctor, can you hear us?
Yes, ma'am.
Yes.
Good evening, madam. I am Dr. Ganesh from Odisha.
Yes, sir, I know you.
Yes, madam.
Yes, sir.
Can you suggest some medicine for ovulation, madam? Like
Yes, sir.
single drugs or multi drugs?
Okay, sir. One I have suggested you that you just want Nasi is very good, sir, in ovulation.
Yes,
Look,
yes.
I will tell you, if you are doing hormonal profile, doctor, in
Pardon?
patients, hormone profile you are doing, hormone
Yes.
profile,
Yes.
FSH, LS, these things.
Yeah.
I will suggest one thing where Nas will act very good. When your FSH and LH both are low, we know for fertility we want to keep FSH, the critical optimal value, we want to keep it at 9. Okay. Some patient will come with 4 or 5. Somebody will, so if you will match with laboratory finding, it will just tell you it's okay. But for us, it is not okay. We want it 8 or 9. Okay. LH you have to be greater than 5.
Right. Okay.
Yes, it should be, because if it will be less than 5, there will be ovulatory issue. There will be no ovulation, anovulatory cycles. Yes, sir. So just look for these two hormones. If FSH and LH both are below 5, it means there is problem in GnRH. Just use Nasya, sir. Very good. Shatpushpa
With which oil or grita?
Satpushpa oil, Nasya.
Pushpa oil.
No, no, yes. But in Pittash Prakriti, we don't use Satpushpa because you know Satpushpa is Tikshna. Okay, so when it comes to Pittash Prakriti, you can use Dhanvantar Tel, Nasya. It's very good, sir. Okay.
In
and
PCOD?
if of Kafach Prakriti, just go for Shatpushpa oil. Nasya. It's very, very good. And you can sometimes we prescribe Satpushpa oil, Kafach Prakriti patient Pratimash Nasya also, 2 drops daily in PCOD, chronic anovulatory cycle. Okay. And sir, if your these hormones level are good, in spite of that patient is not ovulating, you can also plan, sir. We have to look for, sir, AMH also sometimes, you know, antimalarial hormone are very low. In that patient also, if AMH is low, FSH, LH will definitely it will be low. You can plan, sir, Yapanavasti. It acts very good. In low AMH patient, yes, sir. Yapanvasti, Mustadi Yapanvasti, Raj Yapanvasti of 16 days. You can plan, sir. It's very good. Vasti. Okay, sir. In obese patients, sir, in PCOD type of patient, we also get anovulatory cycle. In that patient, Matogalic Vasti is very good, sir. We have clinically used it. Yes, sir. And if you want oral drug, I have told you that Shilajit, Pushpadhanva Ras, it's a patented medicine, sir. Pushpadhanva, I have got very good results with Pushpadhanva. Without any Panchakarma, orally Pushpadhanva gives very good result. So you can this, and Shatavari and Shatpushpa Chun combination in Pittach Prakriti patient. If there is Pittach Prakriti patient, you can reduce the Shatpushpa amount, like only 1 gram, Shatavari 3 gram. In Kafach Prakriti patient, you can give in equal amount. These medicines are very good, sir, for ovulations.
And I have a experience also I want to share here. I have gone to the NIA. They are giving that Jatipal Churna. during
Yes, sir.
at mid of the cycle, they are giving 3 gram of Jatifal Churna twice daily for 3 to 4 days. I think they are giving.
Twice
They
daily,
also, yeah, and they are getting a result. A single drug in my and we are giving that nausea also, but not
Sir,
specifically.
Vachachurna Pradhaman Nase is also good. We have done in some patients here. In Kafach Prakriti patients, sir, Vachachurna Pradhaman Nase.
Okay.
Patient will not just respond with this medicine, but it will she will respond with Vachachurna Pradhaman Nase if there is Kafach Prakriti patient.
Okay, madam. Thank you, madam. Very nice presentation, madam.
Thank you, sir.
Thank you, ma'am. Thank you, doctor. Next, we have Dr. Shalini. Doctor, can you hear us?
Yes, ma'am. Yes, ma'am. I can hear you, ma'am. Good evening, ma'am. I have a
Doctor.
question, ma'am. I have a patient of 45 years of age. She is having fibroid. Previously, it was submucosal, and now the latest ultrasound in March, it shows subserosal fibroid. And she's having excessive bleeding for 2-3 days with lots of clots. So what should be done for that?
Patient is of 45 years.
45 years, ma'am. And the size of fibroid is 50 into 48 into 46 millimeter.
It means 5 centimeter. It's quite
5
a big
centimeter.
fibroid. Honestly, Dr. Shalini, I want to tell with this 5-6 centimeter, we don't get very good result. Up to 2-3 centimeter, we can treat very effectively through Ayurveda. Okay. In 5-6 centimeter, you can do one thing because patient is of 45 years age. In 1 or 2 years, he will get menopause, her menopause. And we all know that after menopause, at the fibroid, because the fibroid is hormone dependent, it just used to shrink after menopause.
Yes.
If really patient don't want to undergo any type of surgery, her health is not aligned, you have to put that patient on conservative management for that 2 years to just put down her symptoms. So you should have to provide her good quality of life. For that, if she has heavy bleeding, I was telling that you have to prescribe some good medicine to her, like styptic medicine, because she has heavy bleeding. No? You were telling
heavy bleeding with passage of excessive clots, ma'am.
Excessive clot. So you have to just prescribe some good medicine, like in between cycles. When her bleeding is over, then you can prescribe her Faltrikadi and the Shmulkwat. Okay. And Arogavardhini, Guruchi, Haridra, along with Nityanandras to reduce the size or compression effect of that fibroid. And when just bleeding is profuse, you can provide Pradrantaklo, what I was telling, Lodrasa and Patrangaso combination. What in fibroid, what two things bother the patient? Bleeding and sometimes pain in abdomen when it is a huge fibroid, like 5-6 centimeter. So you can just, if patient is not feeling and she's not fit for surgery, you just have to treat that patient conservatively for 1-2 months, 1-2 years. And you have to counsel the patient first, because really, honestly, it is not going to reduce 6 centimeter of fibroid. 2-3 centimeter, we definitely get very good result with this conservative management and Char Tel Vasti, Uttar Vasti. But in 45 years patient with 6 centimeter huge fibroid, honestly, we will not get very good result. But you can reduce the symptom, you can cut off the symptoms, so patient can have a good quality of life for 2 years. And after menopause, it will start shrinking. Okay.
But will there be some risk of any cancer or some malignancy type?
No, doctor. It has not been reported yet. Like that fibroid has been, because we all know it is absolutely benign tumor, fibroid. Sometimes there is degeneration and all that thing. Sometimes in very few patients, very rare, degeneration is in fibroid. Sometimes it calcified. Okay, in old age patients. And when there will be calcification, there will be reduction in amount of bleeding itself. So what I am telling you have to just counsel the patient. And you have to give the options, what she wants. You have to be honest with the patient. You cannot tell that I can cut off the fibroid, because it is a huge fibroid. Then let her choose what she decide. Either she wants to go with you with 2 years good quality of life with conservative management, either she just want immediate treatment. If she want immediate solution, then she has to go for hysterectomy.
Okay. Oh.
So you
Ma'am,
should be honest with the
one more
patient.
question, ma'am. There is a patient of 40 years age and she's having heavy bleeding, but her scan shows just bulky uterus, nothing else, just bulky uterus. So what could be the diagnosis for that, ma'am?
So when there is bulky uterus, have you looked for the adenomyosis, doctor?
Ma'am, it is not.
It is not mentioned in a radiology report, na?
Yes, ma'am.
Because with adenomyosis, when uterus is bulky, it means there is thickening of the walls.
Yes, ma'am.
Okay, then 90% it might be adenomyosis. If
Okay.
the scan is not from a good center, they don't mention. They just mention bulky uterus.
Yes, ma'am.
They will not mention anything. So you can do the PV. If there is uterus is bulky and she is giving you the history, then you can just treat that patient on the line of adenomyosis. She has bleeding,
Yes,
profuse bleeding.
she is having heavy bleeding, ma'am.
Heavy bleeding, na?
Yes, ma'am. Yes, ma'am.
So you can just treat that patient on adenomyosis line.
Okay.
Just start styptic, just counsel the patient, because you have to reduce the bulk also now, bulk of the uterus. So you have to go with some Dashmol, Varun Shigru, Aragvardhini, that Tikshnu, Lekhan medicine, Shilajit Vati. But just counsel the patient before starting off 4-5 days of her premenstrual phase. Just stop this medicine, okay? Just put her on Pradhanantak law for correction of just hemoglobin, and it will also reduce that bleeding cycle also. And just before 4-5 days, you should just cut off this medicine, that like the small, because it will aggravate the bleeding.
Yes, ma'am.
All these things, and put on some good styptic drug, Pitta Prashamak drug.
Pitta
Before
shamak.
4-5 days, Pitta Shamak. Just tell that patient before 5 days of menstruation, stop these medicines.
Okay.
And just let her bleed. If bleeding is normal, you don't have to do anything. If first day she shows there is heavy bleeding, just put on some styptic, like Udum syrup is very good, and Stop G is very good. Like Shanukshun, you can prescribe these things. And this way we used to treat the patient. In between the cycle, we give Chedan Lekhan medicine, and Kanchana Gugulu is also very good. I just did that. Google
Yes,
preparation prescribe patient to that
So,
patient.
ma'am, Shilajit Vati will do in such case, ma'am. Yes, you have told, yes, it will do.
Yeah, I have done.
Yes,
Even
ma'am.
in 7-8 centimeter, one of my patient, because I am in Gujarat, she is in like very far away from here, Jamnagar. So she is on oral consultation, telephonic consultation with me. One time she came to Jamnagar. She has 8 centimeter fibroid here.
Okay, so Shilajit Vati will help in 5 centimeter fibroid also. It will work.
The same thing I have told you now. I was being honest with that patient, because her sister came with adenomyosis to me, and we have treated successfully. Secondary infertility, what I was telling, 8-9 centimeter adenomyosis, posterior wall thickness.
Yes,
And hysterectomy was suggested. She was not even just expecting second child. She just came to us for stoppage of bleeding. But by the God grace and by our treatment, he conceived also, and she delivered also. And her elder sister is having 8-9 centimeter fibroid. Okay, so we just gave her treatment option, that this is the way, and this we want to go. What you want? Just let them decide what they want. They want for to go just hysterectomy, and they want, because she is a 46 years age. In 1-2 years, she will be having her menopause. Now she is very fine, and she has improved quality of life, and she is on conservative treatment.
Kodamnakhya Google will also help in such a case, ma'am?
Yeah, Google. I told you, one Google preparation you have to prescribe.
Okay.
Kanchnar or Kukutnakhi you can prescribe.
Okay.
I have also prescribed as her Shilajit Vati, because she is Pitta Shpagati patient.
Okay.
Shilajit Vati also I have prescribed.
Ma'am, can we give Matra Vasti during periods, during heavy bleeding of Chandanbara Lakshadi Tel, as you told?
Look, if there is a emergency condition, you can give, but
Okay.
amount you should reduce,
Okay.
not 60 ml, 20-30 ml.
Okay. So otherwise, in such cases, we should give.
Otherwise, although we just avoid that vasti, because hygiene purpose also she is heavily bleeding. If you have another option, opt another option. There is only way with matra vasti, then you can go. After that bleeding stops, then for prophylactic to manage another cycle, to don't have the relapse, you can prescribe matra vasti.
For how many days, ma'am?
You can use Nasena in that cycles.
Yeah, ma'am.
Phosphorus Naste. I've
Yes.
told you it is good. And because you have to use the nasal route, you don't have to use the anal route, or because due to hygiene purpose, might be you cannot give properly and it may cause another infection.
Patient
And
will
there
also
is
not get ready for that, ma'am.
not comfortable also.
Yes, ma'am. Yes, ma'am. So, ma'am, in other time, for how many days we have to give matra basti of
Matra
Chandana?
Vasina, generally we plan for 10 days.
10 days. Okay.
10 days.
Okay.
But I will tell you, if you are giving with 20-30 ml or 15-20 ml, reducing the amount, you can go for 20 days also in between the cycles.
Okay. Okay.
20 ml. Okay.
Thank you so much, ma'am. Ma'am, can you please share your number, Asuka, so that I can refer this patient to you, ma'am?
Okay, fine. I will just share my number. Okay.
Ma'am.
Thank you, ma'am. Thank you, doctor. Ma'am, next we have Dr. Sapna.
Yes, doctor.
Hello.
Doctor? Yes, doctor.
Good evening, ma'am.
Good evening.
Hello.
Yes, doctor.
Good evening, ma'am. Am I audible?
Yes,
Yes,
doctor,
yes.
you are.
Ma'am, I want to ask, mostly now we are seeing in patients, when patient goes from 20s to 30s, patient is having a decreased duration of bleeding also and amount also during the menses. So what could be
Scanty
reason behind
menses.
that, and what's the treatment?
Scanty menses, no? You are
Not
telling,
scanty,
doctor.
but they have. I'm telling
Decrease
that
in
nowadays we
amount.
are.
Reduction
Decrease
in
in amount
amount.
also. Yeah, and duration also.
Okay. Doctor, we know that this is due to kapha dosha. You know, kapha dosha, aggravation, kapha avarana. Yeah. So again, you have to treat that kapha dosha. And I will tell you the oral medicine, it's very good in this type of scenario. If there is decrease in amount or duration, okay. So
Yeah.
Dashmul is very good. Very good.
Which one, ma'am?
Dashmul Kwatha.
Okay.
Dashmul Kwatha, if patient is of Kafach Prakriti, as I have already told, Kaf will be aggravated. Either she will be of anyone like Vata Prakriti or Pitta Prakriti or whatever. Cough will be aggravated in that patient. Okay. So you just prescribe Dashmul Kwata, Raja Pravartini Vati, Bharangi and Trikatu combination we are using here. Very good. Bharangi Trikatu combination along with Til Gododak Pan. Okay, doctor. These three medicine are just moon in this type of problems. Dashmul Kwata, Raja Pravartini. Yes.
Dose of Bharangi and Sikatu?
2 grams Bharangi, doctor, and Trikatu you have to adjust according to the Prakriti. If Kapach Prakriti, you can go up to 1 gram. If there is Pittach Prakriti patient, you can just cut off Trikatu in that patient. Simply give Bharangi with Til Gudodak Pan. Krishna Til Gudodak Pan. And Raja Pravartini 2 BD or 2 TDS. In Pittach Prakriti patient, you can go with, if she cannot tolerate Raja Pravartini, you can go with Aloes compound, Ghrita Kumari preparation.
Okay. Thank you, ma'am.
Yes, doctor. Thank you, ma'am. Ma'am, next we have Dr. Ritika.
Yes.
Doctor, can you hear us?
Yeah.
Yes.
Okay. Thank you. Good evening, ma'am. It was a very
Good evening,
informative
doctor.
session. Yeah. My question is, in a perimenopausal stage with menorrhagia, even with Asrigdara treatment, most of the cases we'll see the HP percentage will fall down like anything, like it will go below 5 grams. And such cases we may have to refer them for DDNC. And such cases usually they take for hysterectomy.
Yes,
Can
yes,
we
doctor.
help them? Yeah, can we help them to raise the HP percentage according to our medication, madam? Even we will get scared when the HP falls below 5 grams.
Yes, yes. Ma'am,
Within a day it happens, madam. Such heavy bleeding will be there with huge clots. So even before DDNC also, like
yes,
how we
yes.
can manage such cases, madam?
Madam, Dadimati grit is very good in that type of patients because grit we already know that it's Pitta Shamak. We are
Okay.
using Dadimati grit. If patient is of Kafash Prakriti, you can advise Dadimati Avale. It's very good, ma'am.
Okay.
Yeah, and I told you na, just put this type of patient initially on Pradhantak law. I used to put this type of Asrigdara patient initially, and I never stopped that Pradhantak law. It will help in reduction of bleeding also. At the same time, it improves the HB also.
HB also.
Yes, ma'am. And Tadimadi grit, it's very good. It will check the bleeding also. It improves the HB count also of that patient.
Okay.
Ma'am, along with that, if she has, like you were telling, below 5 grams, she might have complaint of just cardiac overload. She might have complaint of just generalized swelling. So you can, ma'am, we know that Punanava Mandur we prefer, ma'am, in this type of patient. But Dadimadi growth along with Punanava Mandur or Tapyadilo, ma'am, we used to prescribe. But I usually just put this type of patient just on preventive aspect from initially Pradhanantak law, ma'am.
Okay.
Pradharvati also, whatever the combination you should prefer, ma'am, some patent medicine. Which have some good iron supplement also and acts on Pradhar also.
Okay. But it will take some time for the improvement of HP percentage. Can we wait?
Yes, ma'am. It will take no,
Yeah,
ma'am.
yeah.
If
So as
patient,
an
I have told ma'am,
emergency,
in this type of patient, we have to just stop the bleeding. First, we can do one thing. We have to immediately stop the bleeding by nasse. So HB will not again deteriorate. And if ma'am really 5, it is below 5, then we have to just, and this is critical just scenario, na? Then we have to just decide what we are just going to do with the patient because it is the life of some patient. It's not about the pathy. With what we are treating the patient, life is very important. And if you feel like no, it is not under our control, ma'am, so we have to just send that patient for DNC.
Yes, madam. Okay.
Yes, ma'am. And if patient comes to you with initially with 8-9 HB, then we have to just vigilant in that patient from initially. Don't let the HB come to 5.
Yeah, I know.
Because we know, ma'am, the patient usually the geriatric time they land in this type of complication very easily.
Correct.
Yes, madam.
Okay.
Thank you,
so
doctor.
much, madam. Thank you so much.
Thank you, ma'am. Ma'am, next we have Dr. Shamim. Doctor, can you hear us? Hello, doctor. Hello.
Recording ನಿಲ್ಸಿದ್ದೀನಲ್ಲ ಹೋದ್ಮೇಲೆ ಆನ್ ಮಾಡ್ತೀನಿ ನೋಡಿ. ನಾಳೆ ಗಾಡಿ ರಿಪೇರಿ ಮಾಡುವಾಗ ಕ್ಲಿನಿಕಲ್ ಒಂದು ಗಂಟೆ ಅಲ್ಲಾಡ್ಸ್ಬಿಟ್ಟು ನಾನು ಕೆಲಸ ಮುಗಿಸ್ಬಿಡುತ್ತಲ್ಲ, ನಾಡಿದ್ದು ನಿಮ್ಮ ಇವ್ರು ಇದಕ್ಕೆ ಬರಕ್ಕಾಗುತ್ತಲ್ಲ ಅಂತ ನನ್ನ ಪ್ಲಾನ್.
Ma'am. Ma'am, next we have Dr. Arati. Ma'am, you are on mute.
Yes.
Yes, ma'am.
Good evening, ma'am.
Yes, doctor.
Ma'am, I have a patient. She is of 17 years old. She had menarche just 2 years back. But what has happened is within this last 2 years, she had two times very long period for nearly 30 to 40 days. And she had a heavy bleeding during that time. So what treatment can be given in future if
Ma'am, you are not audible properly. I just heard
Doctor,
that
can
last.
you just be a little more audible? There is some technical disturbance at your network. Doctor?
Yes.
Hello.
Yes, doctor.
Am I audible now, ma'am?
Yes, more clearer, doctor.
There's a patient of 17 years old. She is teenager. Her menarche was 2 years back. Within these last 2 years, she had two times periods, which was prolonged for 30 to 40 days. And she had heavy bleeding during these two periods. So what treatment can be given to her in future if she had same problem?
Prolonged bleeding only for 2 months, na? For 14 days.
Within
Only
these
for
2
2
years.
cycles.
2 cycles, ma'am. 2 cycles.
And have you ever queried about that some stress factor like exams or
Yes,
some
ma'am.
athletic some activity?
Yeah, she had stress factor, ma'am. Recently, she had 10th result and she has joined college.
Yes, because she has quite a good cycle initially, and all of a sudden, only from 2 cycles, she has some problem, na, ma'am?
Yes, ma'am. Yes, ma'am.
So, ma'am, you can do one thing, just counsel the patient, because in this type of patient, we just, yes, we should not simply jump on the treatment protocol, some long prescription. What does we call it, na? Nidan Parivarjan. Because all of a sudden in this teenage, we just inquire the history. Sometimes they will give you stress history, exam related oftenly, or some indulgence in sports and this type of thing. So consult the patient to avoid stress. And meanwhile, only 2 cycles, you just put on that patient some good uterine tonic, like low dose of Ashok Kheerpan. It's very good. And just be vigilant for 1 or 2 cycle more. When the Nidan factor has been cut off, it might happen sometimes. Exams are over, then her cycle will be regular. Okay, ma'am. So we don't have to jump on some treatment protocol, a long treatment protocol in this type of patients. If it's due to stress induced, either due to exams or this type of some just short term factors. But you can put on that patient on good uterine tonic, ma'am.
Okay, ma'am.
Like Ashok Kheerpan is very good in this type of patient. Shatavari is very good. We just put one combination Shatavari ST Madhu along with that Kheerpan.
There's the Shatavari good in our hospital.
Yeah.
Can we can give that Shatavari good, madam?
Yes, ma'am. You can give Shatavari good. Good itself, it will increase the HB count in that patient.
Yeah, she had her HB also low, ma'am.
Yes, ma'am.
Okay.
Shatavari good is very good, ma'am. You can go for that.
Okay, ma'am. Okay.
And just counsel the patient, ma'am, that it will be okay when exams are over. And if exams are over and again she has the same cycle pattern, then you have to follow the whole treatment protocol properly.
Okay, ma'am. Okay. And one more question is that there are so many patients in our village, teenage girls especially.
Yes, ma'am.
They complain of dysmenorrhea, ma'am. Dysmenorrhea with heavy bleeding.
Yes, ma'am. That due to pelvic congestion.
To those type of girls, what regular treatment can be given, ma'am?
Ma'am, in dysmenorrhea, 2-3 line of treatment is very important. Like in local, you have to just give Adoda Snehan Shvedan, ma'am. Locally, below umbilicus. You can give by any oil like Balatel oil, just massage for 5 minutes below umbilicus, and hot water bag fomentation, ma'am. And orally, ma'am, we used to give, you have to just reduce that congestion, ma'am. Okay, so
okay, ma'am.
Good, and we all know, ma'am, in Udavatini Yoni Vapad, ma'am. Dysmenorrhea is one of the main symptoms. So, in that type of patient, ma'am, Rajapravatni is very good. The flow is not proper. Flow is not proper. That's why the blood gets accumulated in the uterus and there will be dysmenorrhea, ma'am. So we used to give Rajapravatni also, and Ajmodaji is really good, ma'am, in that type of patient. And ma'am, Shrotoshodan is one main stand of your treatment, line of treatment. Shrotoshodan, according to the Prakriti, you have to prescribe in that patient. First, there should be no constipation, ma'am. No constipation history.
Okay,
So
ma'am.
it will aggravate the pain. And one very good home remedy, ma'am, we used to follow. Before 5 days of menses, empty stomach, 1 glass lukewarm water with 1 teaspoon of tablespoon of gogrit.
Okay.
Yes, ma'am.
For 5 days before menses,
Yes,
ma'am?
before 5 days, ma'am.
Okay, ma'am. Warm water with 1 glass, 1 spoon of gogrit.
Yes, ma'am. Before 5 days of menses.
Oh, okay. It should be continued during the periods or just before 5 days, ma'am?
She can continue, ma'am. Because we know lukewarm water and gogrit, it will just help in, if she is of poor post, help in that constipation also.
Okay. Okay, ma'am. Okay. Thank you, ma'am. It was very informative session, ma'am.
Thank you, doctor.
Thank you, ma'am.
Thank you, doctor. Thank you, ma'am. Ma'am, next we have Dr. Shilpa.
Doctor, this is this last question? I just.
Yes, doctor. We are asking on hands raise basis.
Yes, doctor.
Yes, doctor. If it's time, we can conclude it after this question, ma'am. No issues.
Okay, because we have one patient in our labor
Yeah,
room.
sure, ma'am. We can close with this question, ma'am.
Yeah, you can just tell them, you can share my number.
Yes,
if they have any problem, they are welcome and we can just discuss on the
Yes, ma'am. Sure, ma'am. I think mostly all are very interested in this session to ask many
It
questions.
was very nice session, ma'am. Very informative too. Ma'am, how can we approach intramural fibroids in this case, ma'am?
Yes, doctor. Intramural fibroid. But doctor,
Yes,
intramural fibroid many times are asymptomatic.
Yes, ma'am. Yes, ma'am.
But by accidentally, if you reveal, ma'am, that there will be no issue of bleeding. No, that patient don't counteract with heavy bleeding like submucous fibroid, ma'am. Okay, so you can just go with the normal fibroid treatment. You don't have to go for streptograzing on all these things. I mean, fibroid we used to give again if it is of desirable size, what we want, like 2-3 centimeter up to. So we used to give, ma'am, the Shmulquat with Vanunchi group, ma'am. And I also prescribed that Shilajit Bhatti, that patient. I have told you for Chetan Lekhan property.
Yes, ma'am. Yes, ma'am. Ma'am, I was having a patient of this bulky uterus initially.
Yes, ma'am. Yes, ma'am.
And I have tried for Lakshadi Churna with Guduchi and Pravala Pisti and like the combination.
Yes,
it was
ma'am.
responded. It
And Guduchi we give along with Arogya Vardhini. Guduchi, Haridra and Midang combination. This in this fibroid patient, ma'am. If she is of
it was previously it was irregular and intermenstrual bleeding also, ma'am. It has came to regularity after 1.5 years of usage, and now she is of 51 years until she didn't got her menopause, and how the bulky uterus has changed into intramural fibroids. How can we deal with this case, ma'am?
Ma'am, you have given Praval Pisti and this type of, no?
Yes, ma'am. Lakshadi Churna, Bolabadda Parpati, and Gudu. Yes, ma'am. Guduchi and ma'am, Guduchi, ma'am. Bhumyavlaki Churna also, ma'am.
Yes, ma'am. Ma'am, you just go for that the Shmulquat, ma'am, for fibroid. And if you are doing Uttarvasti, ma'am, look, if you are doing Uttarvasti, you can put that patient on Charvasti also. Charvasti. Uttarvasti.
Of Pitta Prakriti, sir, ma'am.
Ma'am, it's okay, but you don't have to worry on Uttarvasti about she is of Pitta Prakriti, it's okay. So you don't have to prescribe, you can prescribe, ma'am, the Shmul and along with Faltrika Dikwas in that patient.
Hmm.
And you can go for Varunshi Grukwas, better than Faltrika Di, ma'am, because she don't have bleeding problem, no, ma'am.
Bleeding regularity is there, ma'am, but 3 to 4
Excessive
days of
bleeding is not there.
No, ma'am, no.
So you can prescribe Dashmul Varunshi Grukwas, ma'am, one Guglu. Either coconut Naki Yugo, either that Kanchnar Guglu. Kanchnar Guglu.
Kanchnar I have initially added, ma'am, but the ovarian cyst, function cyst was also there. It has increased in the first 15 days of duration, ma'am.
Ma'am, ovarian cyst, it was hemorrhagic type of ovarian cyst?
It was like, ma'am, hemorrhagic like.
Then hemorrhagic, you prefer, ma'am, Kashore Guglu?
Kashore Guglu. Okay.
Yeah. Okay. In hemorrhagic, you prefer Kashore Guglu.
Yes,
when it's normal, simple cyst, ma'am, prefer Kanchnar Guglu.
Okay. Yes, thank you.
Thank you,
Thank
Doctor.
you so much, ma'am.
Thank you, ma'am. Over to you, Donna.
Thank you so much, ma'am, for patiently answering all the questions. Now, I request Dr. Jeeva, ma'am, Assistant Professor, Department of Shalakya Tantra, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Thank you, Donna. Good evening, ma'am, and good evening, everyone. On behalf of Ayurveda College, Coimbatore, and Team DIKSHA, it is my privilege and a great joy for me to extend a vote of thanks for today's session. First of all, I would like to express my sincere gratitude to Dr. Sipika Swati ma'am for sharing your valuable experience in Asrigdara with a special reference to dysfunctional uterine bleeding and its Ayurvedic management, which is really a need for the hour, madam. Thank you, ma'am. I extend my sincere gratitude to the whole DIKSHA team for providing us with the best virtual platform. Last but not least, let me thank all our delegates who have responded so well to our invitation and made it a grand success. We look forward to welcome you again in our coming sessions. Thank you, one and all.
Thank you, ma'am. I would also like to thank the whole DIKSHA team for giving me this opportunity to just share my views with good participants, and we have just really a good discussion session also. Thank you for that.
Thank you, ma'am. It is not even the beginning of the end, but it is perhaps the end of the beginning. Our next session will be on 20th October by Dr. Vidya Unnikrishnan. To know more about our updates, please do stay connected with our social platform. That's all for today's most interesting session, with a lot of new information for us to close our eyes without provoking knowledge. Thank you all for joining us. Thank you.